Jennifer's given you some details about her cough using that first opening question. But at this stage, it might be useful to ask another open question to find out more information about the cough. Something along the lines of, please tell me more about the cough. Using open questions allows Jennifer to tell her story, and she might give you a lot of the key symptoms and points relevant to her symptoms. Following that, it might be useful to summarise just to make sure that you've gathered all the important information. Following open questioning, it'd be good to go down to closed questioning, as that will allow you to make a diagnosis. Jennifer's already told you that her cough had lasted for 3 months, but it would also, if she hadn't told you that, it might be useful to ask her how long the cough's been there for, as this will help you to make a diagnosis. Certain coughs last less than 3 weeks, and these are what we call acute coughs, and these include things like upper respiratory tract infections and lower respiratory tract infections. Some coughs last between 3 to 8 weeks, and these are what we call subacute causes of cough. Examples of these include tuberculosis, whooping cough, and post-infective cough, which is just irritation to the lungs following an infection. If the cough's lasted greater than 8 weeks, then we call it a chronic cough. Causes of chronic cough include asthma, chronic obstructive pulmonary disease or COPD, and a cough caused by conditions such as gastroesophageal reflux disease. Another cause of chronic cough is the cough caused by ACE inhibitors. ACE inhibitors are medications that we use in hypertension and in heart failure, and often patients can get a dry cough with these. After finding out how long the cough's been there for, it might be useful to find out whether the cough's worse at any time of day. If the patient notes that the cough's worse first thing in the morning or last thing at night, then we may think about asthma, as asthma is often worse during these times. It's important to find out whether the cough's dry or productive of phlegm. Causes of dry cough include asthma, gastroesophageal reflux disease, and the ACE inhibitor cough, where if the cough's productive, we need to think of more infective causes, such as upper respiratory tract infections or lower respiratory tract infections. The cough in chronic obstructive pulmonary disease also gives us a productive cough. It'd be useful to find out about any associated symptoms as well. If the patient mentions symptoms such as blood in the phlegm, significant shortness of breath, copious amounts of sputum being produced, or systemic features such as weight loss or persistent fevers, then we think that there's quite a sinister and serious cause causing these coughs. Those symptoms are what we call red flags. If the patient describes wheeziness, then we need to think of things such as asthma, chronic obstructive pulmonary disease, and occasionally gastroesophageal reflux. Also, we need to find out if anything makes the cough better or if anything makes the cough worse. If we have a chronic cough that's worse with cold air or exercise, then we usually think about asthma. If we have a chronic cough that's worse after eating or talking, then we need to think about gastroesophageal reflux disease. Certain medications can make coughs worse as well. As we mentioned, ACE inhibitors can give an ACE inhibitor cough. If the cough's made worse by beta blockers or non-steroidal anti-inflammatory drugs such as ibuprofen, then we need to think about asthma, as these medications can make asthma worse.